Good morning, everybody, and thank you for coming today. It's nice to know that people are willing to come and spend a day with us and enjoy the learning about fiscal things, because that's always so enjoyable, as you know, how to pay for mental health services. So I'm going to give a brief overview of KDA. I know most of you know most of this, but I'm not going to go into a lot of detail. But we've been working on this lawsuit for 11 years now. The state, it took a while for the state for the staff level to get involved because it was negotiating with the lawyers and those type of things. But it was finally, the final settlement was done in December of 2011, and that's where we really kicked up our efforts in trying to provide the core practice model. And with the core practice model, what we really, and as everybody knows pretty much in this room, is that the core practice model is really changing the philosophy of providing services and breaking those silos of funding between child welfare and mental health and kind of blending those two. Bringing the child and the family team together and working for one group instead of, oh, this is your child and you provide this service. So we want to make sure that that is a foundation of the settlement and how these services will move forward. Real briefly about KDA, who is she and where did she come from? She was a 14-year-old girl that was, when the lawsuit was filed, she was 14 years old, and she was removed from her home when she was 4 years old. So any of you parents out there know that a 4-year-old, if they need to be removed from the home, she's had a rough go of it. So in this time, since in the 10 years that before the lawsuit was filed, she had been moved 37 times, including 19 stays at a psychiatric hospital. Really shocking for everybody that is in the system and outside of the system. And that is one of the big things that keeps me going with this. Is the work is great, and of course, and working with social services is always fun. But kind of thinking about what she had to go through in those 10 years must have been absolutely horrible for her. So that is one of the things that we keep on looking forward so this never happens again. Some of the things we're working on right now are, I'm sure many of you are involved with, is the semi-annual progress reports. Those were due on October 18th, and we are reviewing those reports. Those were the reports that were with mental health and social services together. We've started the Learning Collaborative, or working with the counties in the several regions around the state, and we're providing technical assistance and training. And some of the task force, for example, the core practice model task force, the recommendations have already been completed, and they are working through those at the state and those recommendations. So again, those are just a brief overview of what we're working on. Very busy right now, and we really appreciate all the work that you're doing to make this happen. And thank you very much for coming.
Good morning. Thank you, Troy. Troy was filling in for Rita McCabe, who hopefully will be here later today. Once again, good morning. I'm Cheryl Treadwell with Department of Social Services. And before I begin, I would like to just sort of take a poll to see who's in the room. How many of you are here from mental health? Wow, that's cool. Social services? Okay. Providers? Okay. Any other categories that are here? Probation, yes, my probation friends. All right. Well, first of all, I'd like to extend greetings on behalf of my director, Will Lightbourne, and my deputy, Greg Rose. We really appreciate you guys turning out for this very special day. And for me, this is one of the opportunities to come before a different audience. In fact, our healthcare service partners and I have been on a lot of road shows, a lot of conferences, really just to kind of seed and promote some of the implementation activities that are required by the KDA lawsuit settlement. But it's also an exciting time, I think, at the same time for us, because I believe it's a window of opportunity. There's momentum in the air, and it's very exciting. So I'm almost feeling like I need music or something. I don't know, but this is the wrong conference. And if this would be my theme song, if you know anything about the OJs, I would say money, 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 because I know that's what's behind a lot of this. All over the states, we're seeing all kinds of emerging models of collaboration, and we're all recognizing that we can't serve our children alone. And we know that innovation in what we're doing today is very necessary, and it's very hard to do that. It's easy to say, but we know it's very hard to do. And it takes time to churn some of those things. So I'm hoping today that what we'll hear from our speakers, some of the developmental kind of fiscal strategies that are happening across the country to serve our population, to give us an opportunity to re-examine our fiscal structures and figure out how they can support the collaborative practice model that we're trying to implement. I think we have some very perfect choice opportunities right now that are emerging in both of our systems. As we all know, and some may not know, especially for our mental health partners, we have the continuing care reform efforts. We have the idea of reducing the reliance of group homes through that effort. We're reforming and transforming the nature of group care. It's recognizing through those reforms the value of public-private partnerships, which I think is very important for us to be aware of. There's also continued opportunities in the mental health world. Over the last few years, we've seen the system of care developments, and most recently with the Mental Health Service Act, which is driven by local priorities fiscally. And then now with affordable health care, the whole effort of trying to merge primary care with mental health and substance abuse. So I think also that the benefits, I mean, I'm sure people can argue there are challenges with realignment, but there are also benefits to realignment. I think that creates an opportunity in terms of how we use flexibility to fund some of the work that we've done. Recently, I attended the CWDA conference and sat in on a workshop around social services one-on-one financing, and I was pleased to see some of the discussion around the opportunities of how to work with, in the world, realignment and working with other partners in terms of bringing the funding to the table and looking at models. We also have the interest of 18 counties exploring the flexibility of a 4E waiver, the Child Welfare Demonstration Project. And then currently, as a result of KDA, we're moving toward creating therapeutic foster care as a Medicaid service. So, I mean, there's opportunity everywhere, and I think that this is really an exciting time for both systems. Seeing the momentum also coming from our federal partners, fiscally and also in terms of policy, giving us a permission to kind of look at how we design benefits for kids, especially funding more opportunities in terms of home and community-based services for children in the foster care system. So we know that we are setting the expectations high, and we're asking you to do a lot with less and with the same. But I also think that it is an opportunity to think about healthy disengagement. And by what I mean is that there might be a possibility, or there should be a possibility, to think about what things that we're not going to continue to pay for. You know, in terms of looking at what is really the right set of packages for our kids and having the kind of flexibility and adaptability to change those packages of services when they need to be changed. Last week, or a couple of weeks ago, we also had the kickoff with 18 counties in our learning collaboratives. Those counties will be a great source and wealth of information in terms of, as we march through implementation, they will provide to us and to the state. We hope to share what lessons learned will come out of moving forward with the practice model, what some of those challenges might be, what some of those strategies might emerge out of that opportunity. That's being partnered with our regional training academies. And for our mental health partners, the academies are the statewide training system that provides the training to our social workers. That'll be a new resource that we have the ability to share with our mental health partners as we move forward with thinking about integrated training. So that's an exciting effort to look forward to as well. I read something the other day, and I don't know if the Children's Mental Health Partnership folks were in the room, Beverly Abbott, and Pat Jordan. They had some material that I thought was worth sharing, and it basically said that collaboration is not easy, but it works, and together we can serve thousands of children and families who depend on us for us to have the ability to work together, to collaborate on their behalf, that it takes time, it takes skills, and it takes a different mindset. So I will leave you with this African proverb quoted, and it says, if you want to go fast, you can go alone, but if you want to go far, you have to go with others. So keep that in mind as we go forward through the day, and I really look forward to hearing what Jim and Beth have to share with us, and then the afternoon to really hear about some of the best practices with the county panel. So thank you for coming this morning, and I'll move forward and turn it over to Deborah.